House Bill 4666. Imagine this. Imagine a family whose child relies on Medicaid therapy. If the state agency that oversees that program starts having problems, lawmakers used to find out every few months through regular reports. Under this new law, it might take up to 2 years before anyone outside the agency even sees what's going wrong. What the bill says it does? House Bill 4666 says it streamlines government by reducing how often the Health and Human Services Commission must send reports to the legislature. It combines deadlines and cuts the number of required reports so staff can focus on services instead of paperwork. What it actually does? It slows down oversight of programs like Medicaid, CHIP, and disability services. This means HHSC can now report problems or results far less often, while lawmakers and the public lose the ability to spot trouble quickly. It also removes a funding safeguard that once required legislative approval before these changes could take effect. Who benefits? HHSC leadership, which gains more control over reporting schedules, Medicaid managed care companies, and hospitals, which face fewer public performance reviews. Who pays the price? Families who depend on Medicaid or disability services. Lawmakers and watchdogs who rely on timely reports to hold the agency accountable. And why it matters. Texas needs transparency to know how their tax dollars are being used and whether public programs are doing their job. When reporting slows, problems stay hidden longer and accountability weakens. Now, questions to ask your lawmakers. How will families and legislators know if Medicaid or disability services are failing without frequent updates? Why remove the funding safeguard that ensured proper resources for oversight? And would you support adding a mid-year progress report so problems can be caught sooner? Bottom line, House Bill 4666 cuts paperwork but also cuts oversight, leaving Texans with fewer ways to see how well their largest health programs are working.